Dr. Uzu Institute, we rise and we grow, building skills for the future with all we know. Through education, training, and research we lead, advancing workforce skills, planting the seed from digital.
Today's webinar will explore key strategies for reducing surgical site infections, maintaining sterile environments throughout the surgical process. We are honored to have Mr. Nikwe Emmanuel as our guest speaker. Mr. Nikwe Emmanuel, a respected lecturer and practitioner of sterile processing. Mr. Nikwe brings with a wealth of experience, having transitioned from a dedicated basic school teacher to a leading voice in sterile processing technology. His commitment to preventing healthcare associated infections and advancing surgical safety has earned him both national and international recognitions. Mr. Nikwe's work continues to transform the way sterile processing is approached, and today we are privileged to learn directly from his expertise. We look forward to learning from insights today. Please feel free to share your questions in the chat throughout the session. Mr. Nikwe, we are grateful for having you on this webinar.
All right. Good afternoon, everyone. It's a real pleasure to be with you this afternoon, morning, evening, wherever you are tuning in from around the globe. And a very warm welcome to Dr. Usu Institute Innovation Spotlight webinar. As mentioned by the host, my name is Emmanuel Nikwe, and I'm genuinely honored to have been invited by Dr. Usu Institute to share some insights with you today. In as much as you are not taking infection prevention courses at the moment, infection prevention cuts across all domains as the answer lies in the universal principles of excellence. Now, anytime you talk about infection prevention, it is about precision and attention to details. That is what infection prevention is about. And then mistakes have direct consequences. That is something you must understand, that mistakes have direct consequences. Just like taking driving lessons. If you take your eyes off the road, it can lead to an accident. So anything applied to infection prevention can also be applied in other domains. And it is also about system thinking, understanding how individual actions impact a larger system. What you do today may have consequences on other people. It may have a negative impact, it may have a positive impact. It is also about risk management, identifying and mitigating potential failures, and you can apply that to all domains of life. So today, join me as I take you through infection prevention, helping you obtain some knowledge about infection prevention, irrespective of your domain. And in sterile processing, we believe that this field is a field of continuous improvement. You always have the mindset that you can do better than your today. So you are always aspiring to make your tomorrow better than today. And that is in learning. Any sterile processing technician who doesn't like studying is not a professional sterile processing technician. When you're a sterile processing technician, you always have to keep updated with current industry trends, and that is what the field is about. Okay, now let's turn our attention to the specific principles of safeguarding patients' lives, which we'll be discussing in this webinar. So to begin with, let's get to know what healthcare associated infections are, or what you may call surgical site infections. You go to a hospital with your own illness. Because I'm dealing with surgery, I'm going to tune it directly with surgery. So you may have an infection or not, but a problem will lead you to the theater, the operating room. You go there with your own problem, and at the end of the day, you leave the facility with a different problem. That is a different infection, a different illness. How did this come about? That is why sterile processing technicians are there. So, healthcare associated infections or surgical site infections, simply put, are infections one may get or acquire in the course of receiving treatment in a health facility. So you don't go to the facility with that illness, but you leave the facility with that very illness. And These infections vary in severity from superficial skin issues to much deeper, more serious complications, depending on which surgical site infection you may have acquired during your stay in the health facility. The broader impact. Why should this even concern us so deeply? When you acquire a surgical site infection or a healthcare associated infection, it prolongs the pain because you are trying to recover from one thing, then you have another. That would also mean you have to spend more money treating other sicknesses, and it can even lead to death. That is why you need to be concerned with surgical site infection. And this ripples outward. They increase your hospital stays, readmissions, it drives up the healthcare costs, and it puts strain on healthcare systems. Even for the institutions themselves with the health facilities, anytime your patients are leaving the hospital with any form of surgical site infections, it makes others lose trust in your facility. The same thing can be applied in other businesses. If you are serving people but they are always having problems with your service, they tend to lose trust in what the kind of services you are rendering to them, and you may not be recommended to other people. So wherever you find yourself, know that anything that you do has either a positive impact or a negative impact. While one may get healthcare associated infections in the course of receiving treatment in the facility, this instance can be mitigated, and that is where sterile processing technicians come in. So one may ask, who is a sterile processing technician? Now, a sterile processing technician is someone who cleans, assembles, packages instruments, sterilizes them to make sure there are no microorganisms found on those instruments, and make them available for surgery whenever needed. That is the role of a sterile processing technician. Meaning, that is the role of a sterile processing technician. You are there to make sure that when instruments are used on a patient, the next patient that the instruments will be used on wouldn't acquire any form of infection. So it is not just about cleaning. In as much as we are doing cleaning, the cleaning that is done is quite different from what is done in our various homes. When it comes to home, your definition of clean varies from the health facility. So you just do your dishwashing, you wash it, you put it there. In sterile processing, right after washing, just like the normal way of washing your dishes, it must go into another level, which is the sterilization or high level disinfection. So our definition for clean may vary from our normal clean we know in our various households. So star processing technicians, they are unsung heroes. They are always working behind the scenes. They are not usually seen, they don't take the credit so much, but this is a job that you do with passion. You know that anytime there's a successful surgery, you contributed to that surgery. Your face may not be on the television, the family of the patient may not call out your name, they may not give you credit, but you are always proud of yourself anytime there's a successful surgery, anytime a patient leaves the facility to their various homes without any healthcare infection. And that is the job. It is not even a job. We take it as a passion. It is a way of saving lives in the community wherever you find yourself. Talking about this, I'm going to talk about a key principle that guides the sterile processing activities. We have what we call the principles of asepsis. So one may ask, what is asepsis in the first place? Okay. If you talk about asepsis simply means the absence of pathogens. And if you ask what pathogens are microorganisms that cause diseases. So how do you bring about the absence of pathogens? And that is the work of sterile processing technicians. So undertaking our activities, our jobs, we have five principles that govern our activities. The first principle every sterile processing technician is expected to know is to know what is dirty. What we identify as dirty is different from what may be identified as dirty in our various home settings. In surgery, any item we identify as dirty is an item that has been to the OR, has either been used or not used on the patient but returned to our department for reprocessing. Let's have a scenario. You walk into a supermarket, you see a biscuit rack, you get one biscuit. On getting the biscuit off the shelf, it is already opened, but the quantity is intact. Are you going to buy that biscuit or not? You are not going to buy it. Why? Because you feel the biscuit is contaminated. It is the same thing that happens when it comes to surgery. Anytime an instrument set is open but not used, we still regard that instrument set as contaminated because it has been exposed to the environment. And when the instrument has been used on the patient, it is clearly visible that that instrument is contaminated. So that is you knowing what is dirty. And then the second principle is knowing what is clean. What do we identify as clean? In sterile processing, our activities run through four stages, or let me say four areas. We have what we call the decontamination area. We have the preparation and packaging area, which we call prep and pack for short. We have the sterilization area, and we have our sterile storage area. One may ask what is done in these areas. Okay, so beginning with the decontamination area, that is the area where we receive the sold items after surgery. So anytime the items are being used for surgery, they are returned to the decontamination area. And that is our cleaning area. That is our laundry area. That is where we clean up all the instruments, remove all the blood, the body fluids, which we call the soil of the instruments, and then make them available for the next room. Just like our home cleaning, we may either do it manually, mechanically, or both. But it is advisable that every health facility does both. Sometimes you may wash your very white clothes, and in as much as you put it in your mechanical washers, you still prefer to do a little bit of manual washing because you believe that the machine may not guarantee you the cleanliness that you are expecting. The same thing applies to the surgical instruments. Doing it manually alone is good, doing it mechanically alone is good, but for a guarantee that the items were actually clean, it is advisable to do it both manually and mechanically. Everything about sterile processing is also about manufacturer's instructions for use. That is why we say that this area is an area that deals with precision. You don't just do anything that you like. Always know that people have set their path. There are guidelines you must follow. The manufacturer made the product, you were not there. So these are the instructions that have been given to you. This is what the manufacturer expects you to do. What are you going to do? You don't do what you like. Even if you buy, let's say, a washing machine from two different companies or two different brands, the manual that is given to you for one brand differs from the manual you are going to get from another brand. Even with the cars that, for those of you in the school of driving, the driving lessons you are taking, you have manual, you have automatic. You don't approach a manual car the same way you approach an automatic car. Even if both are automatic, they are coming from different brands. These days, you see cars with push and start buttons. You have to push and start. Others also have keys for sparking among different configurations. So everything that you do, you don't do it without the manufacturer's instructions for use. That is the underlying principle. Follow what the manufacturer is telling you, and you are going to get your great results. All right. So from the decontamination area, after your instruments have been cleaned, we then take it to the next area, which we call the prep and pack area. Now, in this preparation and packaging area, this is where you inspect the instrument for cleanliness and functionality. So you inspect the instrument, you make sure that it was properly cleaned. If you identify any soil, debris, any blood, body fluids on the instrument, you take it back to the decontamination area for cleaning. we don't clean in the prep and pack area. So you take it back for re-cleaning, then they bring it back to you. You perform your inspection safety checks. You can apply it in every field, in anything that you do. Just make sure that whatever you are dealing with is in perfect condition. You don't, um, maybe for those coding, yeah, I know people are taking web development courses with Dr. Wusu Institute. You write a code today, you sleep the next day, there is a bug. You have to debug your code. You say the code was working. Why is it not working the next day? You see, all these are, then you begin your debugging. They are all safety checks. In everything that you do, if you are not performing the safety checks, the maintenance, you are always going to get errors when you least expect. And that is how it applies in sterile processing. So you perform your safety checks, then you go ahead to wrap the instrument. We don't just send the instruments to the OR as it is. We put them in appropriate containers. We prepare them for sterilization. So once we prepare them for sterilization, we put them in machines that are expected to kill the microorganisms on the instrument. After the machine has also done its job, you just check to make sure that it performed as expected, everything is intact. Then you store them and deliver them to the user department, usually the ORs, the theaters, labor and delivery, whichever area that needs that particular instrument set, you just make it available to them. But when transporting, you transport it aseptically, that is without contaminating the instrument. I always say to my students that just have it at the back of your mind that this instrument I'm processing is going to be used on my family member. So if the instruments are going to be used on your family member, are you going to handle the instruments anyhow, or you are going to handle the instruments professionally? If you are going to do the same, handle it professionally because it will be used on your family member, then take it as though every patient entering the facility is your family member. If you are driving on the street and your child is crossing the road, you stop for your child to cross. So take it as though everybody on the street is your child. If you are doing something for someone, assuming you were doing it for yourself, how are you going to do it? If you are going to take your time because you want to achieve better results, if you are coding for a client because you want the client to be out there and people give you gratitude, then you take your time to do it. So everything that you do, you have to do it in a way that it is so pleasing. And that brings me to my last thing I'll be discussing when it comes to infection prevention. If you want to achieve all these things, it all boils down to quality. Quality. From the onset, I mentioned that sterile processing is a field that we believe in continuous improvement. We always believe that we can do better. And anytime you are living life with that perception, you always take steps that build you personally and professionally because you have that concept of quality at mind. I can always do better than what I'm doing currently. And that is something that guides the activities of sterile processing. And one may ask, what is quality in the first place? In simple terms, I may say quality is the degree of excellence of a product or service. The degree of excellence of a product or service. For all those who have joined this webinar at this time, I believe you have your favorite clothing brands, electronic brands. Some people may, those of you doing coding, some people may prefer Mac, others may prefer HP, different brands. Whichever brand you are looking out for, something might have pushed you to look out for that brand. And it all boils down to quality. If I buy any brand of a laptop and I don't have a great experience with that laptop, the likelihood that I will buy that same brand the next time is very low. I wouldn't go with that brand. But if I buy a brand of a laptop and it lasts longer, it performs as I expect, the next time someone even comes to me for recommendation of a laptop, I am I am likely to recommend that to them. And that is how quality works. In short, quality is seen in the eye of the customer. The customer is the person going to judge. As I sit here, I cannot boast that I am a good lecturer, but it is my students that are going to make me know whether I'm a good lecturer or not. So if I hear many people saying, "Oh, Mr. Emmanuel is a good lecturer, he explains, he does this," then I know, okay, I'm doing a good job. But I can't just stand up and boast that I'm doing the right thing. It applies everywhere. Some of you may like maybe Louis Vuitton, others like the polo, because probably you might have bought a polo shirt, it's lasted longer compared to other brands. That is how quality it is measured in the eyes of your customer. So in sterile processing, who are our customers? Our customers are not the patient. We don't deal directly with the patient. We deal with the people in the theater and they work on the patient. So people these are the people who are going to judge our work. Okay, what is the best ways to prevent infections at home? All right. One advice I'm going to give you is there are people who might have taken first aid trainings. If you have not taken any first aid training and there is an injury at home, don't, if you are not a professional, if you've not been trained to give those first aid and treatment, don't attempt. If you go to certain countries, even if someone is involved in an accident, it is not advisable for people around to get the person to the hospital. Why? Because you may not know the kind of internal bleeding the person is having. So the way you even lift up the person from the ground into the vehicle can cause the person to lose his or her life. So if you don't have any specific training when it comes to infection prevention, seek the advice of health professionals. Don't attempt. When it comes to the health field, if you don't have expertise in something, you don't attempt. I work in a health facility, but I don't give injections because that is not what I've been trained to do. So if you are home and any injury occurs, if you have training in first aid, fine. But even after the first aid, get your ward, whoever is involved, to a health facility for better assessment. Maya City, I believe I answered your question. Okay, let's move on. So I was talking about, yeah, quality, and this basis of quality gives no measurement. Once it is being judged in the eyes of the customer, um, you cannot just boast. That, let me put it that way. You cannot just boast. So you are always doing things to please your customer. I work with the OR, they are my customers. So I'm always doing things that are going to make the OR happy, the operating room. They are going to be happy with my services. The instruments I provide to them, they are very clean. They are used on the patient gets no infections, and I know my job is done. It may apply to you also. If you are doing web development, at the end of the day, you are not the one to judge the work you have done. You know, sometimes for those of you doing web development, you may write a code, the website may be looking appealing to you. You know that, okay, I've done this website to expectation. But the client you are building the website for is not impressed. In as much as you think you have done the right thing, when your client is not impressed, you have done nothing. And that is the basis of quality. If you are not doing it to the excitement of your customer, you haven't done anything. If you are driving and your passengers are shouting at you, are scolding you, and all that, it doesn't make you a good. If your customers are not okay with the kind of services you are offering, nobody is going to judge your product as quality. And as institution which always of leadership, I always say be a leader and don't be a boss. That is my principle. If I want you to become like me, I train you in a way that you become like me. I don't sit in my office and then instruct you. No. If I want you to learn how to clean instruments, I come to the field. I am with you. I clean one, then you also clean one. If you make a mistake, it happens. Somebody must be in the vehicle with you. Aside the classroom lessons, yes, I've had the theoretical aspect. Now let's come to the practical form. If you say you're a good driving lessons teacher, you can never teach the person in the classroom and expect the person to be perfect on the field. It applies everywhere. So if you want to obtain quality, you have to be a leader. A leader leads. A leader has followers. So you set the pace and others follow you. That is how quality is obtained. It is about leadership. And anytime you want to achieve quality too, you have to get, let me say, a data structure. You have to put a plan in place. This is what I want to achieve. You are setting targets for yourself. Then you compare your targets with your actual outcomes. So, as a sterile processing technician, I always want to be at the top. All right, early in the morning, the number of instruments I'm supposed to make ready for surgery are not supposed to be less than 10. That is maybe as at 7 a.m. That is the target I have set. So I come to work in the morning, and the instruments I made available for surgery were just three. My target was not supposed to be less than 10, and I made only three available sets for surgery. Did I meet my target or not? I didn't meet my target. Then you come back. What went wrong? Why didn't I meet my target? What can I do to make it better the next time? When you begin answering all these questions, then you know that you are driving towards quality. Sometimes you can even involve your customers. So people sometimes get questionnaires. So you get questionnaires for your customers. You ask them about the kind of service you are rendering to them. What are you not doing right? What can you do better? Among other questions. So all these questionnaires, when you are getting your feedback, then you know you are driving towards quality. And I mean, if you have the mindset of always becoming better, making your tomorrow better than today, you always find ways and means of achieving that goal. Anytime there is a problem, and you have to be accountable, accept it when you make mistakes. If you don't accept your mistakes, you can never learn. If I make a mistake in sterile processing today, I only admit and I make sure I don't repeat that mistake. Because this work that we are doing in sterile processing, one mistake can lead to the death of a patient. So we don't have anything like I have been efficient 99%. No, you must always be 100% efficient. You are always judged based on the last instrument you provided to the theater, to the operating room. So if every day I do my work correctly and today I send a tray that is incomplete, the patient is lying there. I have put the patient's life in danger. And the doctors, the physicians, they are going to judge me based on that very day's incident. They don't care about what I've done in previous years, what I've done in previous days. You are always judged based on your current status. So, in quality achievement, don't always go back. You always try to move forward. Don't aspire to obtain 100%. 99 is good, but it is not best. Good is not good. One of my lecturers said to me, good is not good, while better is expected. I believe I have come a long way with you this moment. And yes, you may not have heard of sterile processing technicians, but they are unsung heroes. They work behind the scenes. They make sure that anytime someone comes to the hospital for surgery, the person doesn't leave with any form of infection. It is not just a job, it is a passion. It is a way of giving to the society. It is a way of ensuring that everyone who comes for surgery is safe. At this juncture, I would pause to take questions from you if you have any questions. The question.
Thank you, Mr. Nikwe.
You're welcome.
We have some few questions that my audience want to ask you.
Okay.
First question, they said, what happens if a sterile package accidentally drops on the floor during a surgery?
What happens if a sterile package accidentally drops on the floor during surgery? Did I get your question right?
Yes, please.
Okay.
Yes,
All right.
please.
That is a good one. Okay. So during a surgical procedure, okay, if an item accidentally drops on the floor in the operating room or any sterile environment, it is immediately considered contaminated. Even if the packaging looks intact, the impact of hitting on the floor can create these microscopic holes or compromise the seal. So once it falls on the floor, you cannot use it on the patient. That item has to be returned to the sterile processing department for reprocessing. It is considered contaminated.
Oh, okay. Okay. Thank you.
So,
And our second question is, what if a patient doesn't follow the pre-operative instructions, like bathing properly?
okay. So if a patient hasn't followed instructions like bathing or showering with an antiseptic soap before surgery, the surgical team usually has protocols to address this. What they do is the nursing staff will assess the situation. They will ask the patient why the instructions were not followed. It could be due to misunderstanding, lack of resources, or physical limitations. So, depending on the policy and severity of the non-compliance, steps will be taken, and this might involve, providing antiseptic solution and assisting the patient with a proper wash on the day of surgery if the time permits, or using more vigorous antiseptic skin preparations in the operating room. And in extreme cases or for highly susceptible patients, the surgeon might even consider delaying the surgery if the risk of infection becomes unacceptably high due to inadequate preparation, though it is rare and only a last resort. That is why patients are really educated on what they need to do before a surgical procedure.
Oh, okay. Thank you very much. Please, our last but one questions. What are the biggest challenges you face in sterile processing departments in Ghana or Africa?
Okay, that's a good one. Um, in Ghana or Africa, or in many parts of Ghana and across Africa, sterile processing departments, usually face several significant hurdles, and these directly impact infection prevention. In Ghana, there are resource constraints, and this is often the biggest challenge. You have outdated machines, equipment, washers, disinfectors, sterilizers that might not be as efficient or reliable as newer models. And some facilities may also not have insufficient instrumentation. So they use one instrument, they have to make them available for the next patient. But the time it takes to reprocess the instruments are not sufficient. So they just reprocess them anyhow and make them available for surgery because they are needed. And all these also lead to surgical site infections. There are limited consumables as well, shortages of high quality detergent. Sometimes people are forced to dilute certain detergents which are not supposed to be so. The brushes may be old, but they still use it for cleaning. The sterile wraps, chemical indicators, biological indicators, among other consumables. Um, you can also look at infrastructure wise, the water qualities, the power fluctuations. Sometimes you are sterilizing an instrument, then the electrical power it goes off like that. All these things are challenges that are being faced by sterile processing technicians in Ghana, and I believe it cuts across Africa.
Okay. Please, our last question. How can smaller clinics or facilities with limited resources still maintain good infection control standards?
How can similar clinics or facilities with limited resources still maintain good infection control standard? Was that the question?
Yes, yes, those smaller clinics.
Okay, all right. So, smaller clinics and facilities with these limited resources, they can absolutely maintain good infection control standards by focusing on the fundamentals of being highly disciplined. You prioritize basic hand hygiene. So hand hygiene is the cornerstone of infection prevention. We are always washing our hands. If you are not washing, you are using alcohol-based sanitizers. All these help to reduce bacteria. And emphasis must be on manual cleaning and disinfection. If you don't have the equipment to perform mechanical washing, then you have to make sure that the manual way of cleaning instruments is done adequately. It is not all of us that have, let me say, washing machines in our various homes. Therefore, we rely on the manual way of doing laundry. And if you are doing it manually, you take your time, you wash it in a way that you believe your items are, your clothes are very clean, and you have to follow strict aseptic techniques. Whatever guideline that has been laid down for you to perform your activities, you must follow that guideline. Just like I said, the factor's instructions for use is very paramount. And what we can also do to help each other is to perform in-service training. Sometimes we visit hospitals, clinics that are not so big, they don't have it all. Some people even don't have trained professionals to be carrying out certain activities. They normally fall on the orderlies or the janitors to be doing this cleaning, which is not appropriate. So we usually organize these workshops for these smaller clinics and facilities and then educate them on the principles of
Okay.
ASEF. Yeah.
I know we have learned a lot from you today. And thank you all for joining us today for the Innovation Spotlight webinar. A big thank you to Mr. Nico Emmanuel for sharing such valuable insights on infection prevention and control in surgery. Your experience and passion for sterile processing have truly been inspiring. We hope everyone is living with a knowledge and a practical tools to apply in your work and studies and also in your various homes. Don't forget to check out our upcoming events on www.innovation. Thank you all for being here. Stay safe and see you next time. Bye bye.
At Dr. Uzu Institute, we rise and we grow, building skills for the future with all we know. Through education, training, and research we lead, advancing workforce skills, planting the seed. From digital literacy to tech innovations, we're shaping minds for tomorrow's generations. With every lesson, every step we take,